Welcome back to the deep dive. You know how sometimes with little kids, an illness just seems to, well, pop out of nowhere? Maybe a really high fever, then perhaps a rash. It can be a bit confusing, right? Well, today we're going to try and demystify one of those really common ones, Roseola Infantum. You might know it as Sick's disease. Think of this as your high yield guide. Really helpful if you're looking after young children, or maybe even if you're prepping for medical exams. We've basically boiled down the key info from pediatric revision notes. So our mission, simple, give you a clear, memorable, and hopefully not too dry understanding of roseola. Okay, ready to jump in?
Absolutely. And roseola is definitely something you'll come across. It's a very, very common viral thing in young kids.
Yeah.
And it has that pretty classic pattern. First, a high fever, then a rash shows up. That's really what we're going to unpack.
Okay, so let's start right there. When we say roseola, what is it exactly? What are the absolute key things we need to know first?
Okay, so at its heart, Roseola infantum is just a common viral illness, mostly in young children. The big defining features are that high fever usually comes on pretty suddenly, and then after the fever goes, a rash appears. And like you said, it's also called Sick's disease. Now, what causes it? It's usually down to two viruses, mostly human herpesvirus 6, HHV6 for short, and less often human herpesvirus 7 or HHV7.
HHV6 and HHV7. Got it. And how do kids typically catch these?
It spreads through the usual ways, really. Respiratory secretions, so, coughs, sneezes, droplets in the air, and just close contact with someone who's infected. Pretty standard for these kinds of viruses.
Right, the sort of everyday contact you get with little ones. So digging a bit deeper into the causes, the etiology, anything else interesting there? Maybe things that aren't immediately obvious.
Well, yeah, one interesting point is about HHV6. While roseola itself is usually pretty mild, HHV6, the virus, has been linked, though it's quite rare, to some more serious things like aseptic meningitis or even hepatitis.
Oh, okay, meningitis and hepatitis, that sounds a bit scary.
It does, but I really want to stress, these are rare consequences. The vast, vast majority of kids with roseola just get the fever and rash and recover fine. But it's good to be aware it's possible, however unlikely. And actually another really practical point, especially for parents or childcare settings. School exclusion usually isn't necessary for roseola. Once the child feels well enough, even if the rash is still there, they can often go back.
That's super helpful, that school exclusion point. So who tends to get roseola most often? Is there a specific age group we should think about?
Yeah, there really is. The peak age is typically between 6 months and 2 years old. That's the sweet spot, so to speak.
6 months to 2 years. Why then, specifically?
Well, it's often when the immunity they got from their mother starts to wear off and they haven't built up their own immunity to these specific viruses yet.
Yeah.
So the main risk factor is really just being in that age group and, of course, being exposed to someone who's infected,
Yeah.
especially when they have the fever, as that's when they're likely shedding the most virus.
Makes total sense, that vulnerable window. Okay, so let's talk about what's actually happening inside the body. The pathophysiology. What's the journey from getting the virus to seeing those symptoms?
Right. So the virus, HHV6 or sometimes 7, gets into the body and starts replicating, multiplying. It's this initial viral activity that seems to trigger that really sudden high fever. And that fever usually hangs around for about 3 to 5 days.
3 to 5 days of high fever. Okay.
Yeah. And then comes the really characteristic part. The rash usually only appears after the fever starts to go down, or as it breaks.
Ah, right. The fever breaks, then the rash. That timing is crucial, isn't it?
It really is. It's one of the biggest clues. The thinking is that the immune system initially ramps up to fight the high level of virus causing the fever. Then, as the immune system gets the upper hand and starts clearing the virus, the rash appears, possibly as part of that immune response or interaction.
So the rash is almost like a sign the body's winning the fight.
You can sort of think of it that way, yeah. The immune system is responding, the viral load is dropping,
Right.
and then boom, the rash comes out.
Okay, that delayed rash is definitely something to lock away mentally, but, lots of childhood illnesses come with rashes. How do we tell roseola apart from, say, measles or something else? What are the key differential diagnoses?
That's a really important question for anyone assessing a child with a rash. Okay, so let's compare. Measles. The rash usually starts on the face and then spreads downwards onto the trunk and limbs. Often comes with cough, runny nose, conjunctivitis before the rash too.
Face first for measles. Okay.
Then there's rubella, or German measles. The rash also often starts on the face and spreads down, but it tends to be quicker and maybe fainter than measles. You might get swollen glands behind the ears too.
Face first for rubella, too.
Got it. Exactly. Then you have scarlet fever. That rash is quite distinct. It feels like sandpaper, rough.
Mm.
You usually get a sore throat, maybe a flushed face, and that classic strawberry tongue, red and bumpy.
Sandpaper rash and strawberry tongue for scarlet fever. Very vivid.
They are, yeah. And one more thing, always worth considering, drug reactions. Some medications can cause rashes that might mimic these illnesses. So always good to ask about any new medicines the child has started.
Good point. Always check the meds. Those distinctions are really helpful. Face versus trunk start, the feel of the rash. Now, thinking about how common it is, the epidemiology, is roseola something that occurs in big outbreaks, or is it more scattered?
It's generally considered a very common childhood infection, found pretty much worldwide. But you don't usually see massive epidemics like you might with measles or flu. It tends to be more sporadic cases, maybe small clusters here and there. Prevalence can vary a bit, but most kids have probably been exposed by the time they start school.
So common, but generally pops up individually or in small groups.
Yeah.
Okay, let's get really practical now. What does it actually look like? The clinical presentation. What would a parent or doctor typically see?
Okay, so the first thing is usually that sudden onset of high fever. We're talking 39 to 40 degrees Celsius, which is about 102 to 104 Fahrenheit.
Wow, that is high.
It is. And that lasts, like we said, typically 3 to 5 days. Then, as that fever starts to come down, the rash appears. Describe the rash. It's usually pinkish red spots, often described as macular or maculopapular, meaning mostly flat, maybe slightly raised.
Pinkish red, flat-ish spot.
Yeah. And crucially, it usually starts on the trunk, the chest, the back, the tummy. Then it might spread outwards to the neck, maybe the face, and the arms and legs. Another feature is that it often blanches, meaning if you press on a spot, it turns white for a second before the color returns.
Okay, trunk first, then spreads, and it blanches. That's key. What about how the child feels?
Well, during the fear phase, they're often quite irritable, understandably with a high temperature. You might also see some mild respiratory symptoms like a bit of a runny nose or a slight cough, maybe even before the fever kicks in properly.
Irritable, maybe a bit sniffly. Anything else specific to look for?
Yes. There's something called Nagayama spots. These aren't always present, but they're quite specific if you see them. They're little reddish bumps or ulcers on the soft palate, the back of the roof of the mouth, and the uvula, that dangly bit.
Nagayama spas. Okay, that's a good one to know for the clinicians listening. So high fever, then a trunk first, rash, irritability, maybe cold symptoms, possibly Nagayama spots. What about other less common symptoms?
Well, we need to mention febrile convulsions, seizures caused by fever. They can happen usually during the high fever stage. The incidence is estimated around 10 to 15% of roseola cases.
10–15% risk of febrile seizure. That's definitely important for parents to be aware of.
Absolutely. It can be frightening to witness.
Yeah.
They're generally benign. Also, some kids might get a bit of diarrhea or cough along with everything else. It varies.
Okay, so if a child comes in with this picture high fever followed by the rash, are specific tests usually needed to confirm it's roseola investigations?
Honestly, most of the time, no. The diagnosis is usually made clinically. A doctor or nurse practitioner will look at the pattern of symptoms, that classic fever then rash sequence, the type of rash, the age of the child, and rule out other things based on the history and exam.
So rely on the clinical picture mainly.
Exactly. Specific lab tests aren't typically necessary for straightforward cases. However, if the diagnosis is really unclear, or if the child seems unusually unwell, or if there's a concern about complications, then blood tests might be done. These could look for antibodies against HHV6 or 7, or even use PCR to detect the virus's DNA. But again, that's not routine.
Right, reserved for trickier situations. So once you're pretty sure it's roseola, how is it managed? What's the treatment plan?
The main thing is supportive care. There's no specific antiviral treatment for roseola itself. It's all about managing the symptoms and keeping the child comfortable while their own immune system deals with the virus.
Okay, supportive care. What does that involve?
Well, number one is fever management. Using antipyretics, things like paracetamol or ibuprofen, following the correct dosage from the child's age and weight to help bring that temperature down and make them feel a bit better. Number two is hydration. Really important, especially with fever. Encourage lots of fluids, water, milk, whatever they'll take.
Fever control and fluids? Standard stuff.
Pretty much. Then just general comfort measures. Keep the room reasonably cool, dress them in light clothing, maybe a lukewarm bath, or using cool washcloths if that seems to help them, and of course monitoring. keep an eye on their temperature, how they're behaving, their fluid intake, and crucially, advising parents to seek medical advice again if the fever is very persistent or comes back, or if the child seems lethargic or unwell in other ways.
Makes sense. Comfort, fluids, fever control, and knowing when to call for help again. Now, the big question for parents, what's the outlook? What's the prognosis for kids who get roseola?
The prognosis is excellent, really, really good. In almost all cases, the fever settles, the rash fades within a few days without any scarring or problems, and the child makes a full recovery. No long-term effects expected.
Excellent prognosis. That's definitely the headline parents want to hear.
Absolutely. It's generally a self-limiting illness.
But are there any potential complications, even if they're rare? Just so we're covering all bases.
Yes, while complications are uncommon, they can happen. We already mentioned febrile seizures, which are probably the most frequent complication linked to that high fever. Very rarely, more serious neurological issues like encephalitis inflammation of the brain have been reported in association with HHV6 infection. But again, this is very uncommon.
Febrile seizures and, much more rarely, encephalitis. Okay, so important to be aware, but not the typical course.
Precisely. The key is seeking medical help if things seem off, if the fever is unusually prolonged or severe, or if the child develops any worrying symptoms like extreme lethargy, neck stiffness, or seizures.
Right. Now, this has been a lot of great info. Any tricks to help remember all this? Mnemonics or memory tips, maybe?
Yeah, we can try a few. For the rash starting point, maybe think Roseola's rash starts on the trunk, RRSTT.
RRSTT, Roseola rash starts trunk. I like it.
For the viruses, maybe HH6 is the fix, mostly. 7 is less common, heaven. Yeah, a bit silly, but sometimes that helps.
Huh. HH6 is the fix.
Okay, that key timing fever, then rash. You can imagine the rash is a bit shy. It only comes out after the heat of the fever has died down.
The shy rash. That's brilliant. I'll definitely remember that one and for telling it apart.
Just remember the contrast.
Yeah.
Measles, rubella, often face first. Roseola, trunk first. And scarlet fever has that unique sandpaper feel and strawberry tone. Focusing on those key differences helps.
Fantastic tips. Okay, let's try a quick scenario. Say a parent calls, worried. Their 15-month-old had a high fever, like 39.5 C, for 4 days. The fever broke this morning, but now they've noticed a pink, spotty rash all over the baby's chest and back. What's likely going on?
Well, based exactly on that description, the age, the high fever for several days, followed immediately by a rash appearing on the trunk as the fever resolves. Roseola Infantum would be right at the top of my list. That timing is just classic.
Perfect. Fits the pattern exactly. Well, this has been incredibly helpful, a really thorough deep dive into roseola. It seems like, yes, the high fever can be worrying for parents, but the illness itself is usually pretty straightforward and gets better on its own.
That's the main takeaway, absolutely. Remember the key pattern. High fever, then the trunk first rash. Remember the typical age, 6 months to 2 years. Caused by HHV6 mostly. And importantly, the prognosis is overwhelmingly excellent. Just know the signs, know how to provide that supportive care, and know when to seek help if you're worried.
Great summary. And of course, if you listening want to explore topics like this in more detail, maybe for exam revision or just deepening your knowledge, do check out the resources at passthemsra.com and freenasra.com. Thank you so much for joining us today as we tackled Roseola Infantum. Hopefully you feel a lot more confident about recognizing and understanding this very common childhood illness now.